Welcome everyone to day 2 of our Next Generation NCLEX 7-day training. Welcome everyone joining us live all over the world. Thank you for being here and thank you for trusting NCLEX Crusade International to be of assistance and help you prepare to pass the NCLEX, whether it is this generation or next generation NCLEX. As you know, yesterday at 5 p.m. Eastern Standard Time, we began our first day, day 1 of our 7-day training. If you missed it for whatever reason, make sure you go back to day 1 so you become familiar with how the training is going to be and what specific topic we will be discussing throughout this 7-day training. So a little overview of what we discussed yesterday during day 1. Basically, we gave a brief introduction to what the Next Generation NCLEX is, and also we covered a very interesting case study that I know was very beneficial to improve your critical thinking, to improve your nursing knowledge, and to improve and master that ability to answer NCLEX style questions where you have to apply nursing content. Once again, if you did not see that first day, go back to the training and make sure you see the full training. As I promised, during the whole 7-day training, I will be giving free access to our NCLEX Crusade International membership to some of the candidates that are here joining us live. Basically, I have asked everyone to visit our website. This is the website that I provided. I put it in the comment section, in the description section, so you can click on it and register for our membership raffle so you have an opportunity to win the membership and have access to our international membership basically for 3 months. So this is a great benefit that any of the winners will be able to have. That will give you the opportunity to prepare and pass the NCLEX right now. As we discussed in our day one training, we talked about the 6 NCSBN clinical judgment measurement model according to cognitive skills. And we talked about recognizing cues, analyze cues, prioritize hypotheses, generate solutions, take action, and evaluate outcome. But I told you that every day I was going to give you specific strategies to master these 6 cognitive skills. So today we will focus in the first one, recognize cues. So this is going to be the first strategy that we will be discussing to help you pass the next generation NCLEX. But Professor, I saw on a few of the comments, I'm taking the NCLEX now. Can this training help me? Yes, absolutely, because critical thinking is critical thinking. And clinical judgment is clinical judgment. And you're going to need them both for the NCLEX now or the NCLEX later. So if you're happy with what we've been doing so far, if you're ready to start this training and learn this awesome strategy, make sure that you're hitting that like button, that you like this video. This is the way for you to show me that you appreciate what we're doing here totally free on our YouTube channel. So like the video. Make sure you subscribe to our YouTube channel and share this live training with everyone you know that is preparing for the NCLEX. So let's talk about the first strategy. Recognize cues strategy. That's how we're going to call it. Remember that in order to recognize cues, you have to have the ability to look at a scenario and identify which findings or assessment data provide information to you as a nurse in order to use that information to make a decision. whether that decision is based on knowledge or that decision is based on critical thinking. Now, how are clients' findings or cues presented in the Next Generation NCLEX clinical scenario? Well, this is nothing new. We talked about the unfolding case studies yesterday. We talked about that they will give you a clinical scenario. They will give you a very specific scenario, whether it is in the ER, whether it is in the ICU, med-surg unit, and they will give you what is called the history of present illness. So what is going on with the patient? What is the complaint from the patient? And also, they will provide other information. As an example, they can give you information about the current medications that the patient is taking. I will not read this specific photo that you have here because this is just a generalized scenario that I'm giving you. We're not going to go into details because we will do that later on throughout the presentation. But what are common sources and examples of client assessment findings? Well, you're going to see information that you have to analyze. One, in the history data provided by the client or the family member, such as history of past, present illness, family history, medications, and allergies. But also, in these clinical scenarios, they can give you physical assessment findings. In other words, they can tell you that the nurse already conducted an assessment and collected vital signs, breath sounds with auscultation. Maybe the nurse asked the patient for pain level. So this information can also be provided to you in the scenario. They can give you information about behavioral findings. How is the patient behaving? Is the patient aggressive or not aggressive? Is the patient alert or not alert? Responsive or not responsive? Is the patient using alcohol or used alcohol? Is the patient under the influence of illicit drugs? So they will provide very key important information that you have to analyze and determine if they are relevant to this scenario. Another information that they can provide is laboratory test results. They can give you the basic metabolic panel. They can give you a CBC and so on. They can also give you imaging test results such as X-rays, CT scan results, and you have to analyze those results in order to make a decision. Now, Professor, this strategy, the recognized cue strategy, in which type of question will I be able to use this strategy? Well, you're going to be able to use it in highlight type of questions, also in the drop down style of questions, multiple response items, and drag and drop. And on the right of this table, you see the different item variations that you could see or you could use this specific strategy. Now, of course, the live training that we're doing here is very limited on time. We don't have the whole week to cover all these specific topics today. However, we are going to be covering most of these items variations throughout our 7-day training. But today, I want to focus on the highlight in text item and multiple response select and multiple response select all that apply. So we're gonna focus mainly on those types of scenarios. I know that you guys are very interested in learning how to think critically, but we need to know how to respond to this select all that applies. Is anybody here struggling with select all that applies now? Is it going to be different on the Next Generation NCLEX? And the answer is yes. The answer is in most of these new types of Next Generation NCLEX, the select all that applies, one of the greatest benefits that you will see is that you will get partial credit. Whether the selector that applies now, you don't get partial credit. It's all or nothing. But thanks to God, our next generation NCLEX will have that benefit, and you will receive partial credit for answers that are correct and answers that are incorrect. So let's look at an example of how we use this strategy, and specifically how does the highlight in text item looks on the next generation NCLEX. So here it is. It says highlight which findings are relevant to this scenario. So what I want you to do, I want you to read this scenario word by word, and I want you to tell me in the comment section what you believe are relevant information or findings in this scenario. But also try to determine what you think is the most relevant information. So this is a good technique, a good opportunity to analyze your critical thinking and see if you're able to find these cues or keywords that tell you important or relevant information. Let's see how you analyze this. I'm looking at the comment section to see how did you analyze this, because I need some participation here, because in order to guide you, I need to know what are you guys selecting. So my question is, how many of you believe that the age 91 years old is a relevant information? Yes, 91 years old is an important information. How many of you maybe think, well, the information that the daughter is telling me, that is also relevant. That's important. You may say, well, the information that states that the client climbed onto the step stool, that is relevant information. But the most important or relevant information in this scenario is the client apparently lost balance and was found on the kitchen floor. That is the most relevant information in this whole clinical scenario. Why is this important, Professor Ray? Well, this last statement, the client apparently lost balance and was found on the kitchen floor, could indicate that the patient fell. And of course, we know that elderly patients have a higher risk of falling or falls. So if on the NCLEX they tell you highlight which findings are relevant to this scenario, you could select several answers. But in questions that states which finding is the most relevant in this scenario, then the answer will be only one. So I want you to know the difference in how you can see the question and how your answer will vary depending on the adjective and verbs that they're using in that specific question. Now, these type of questions usually are not very difficult. Let's look at another scenario, okay? It says, the nurse performs the initial assessment and documents these clients' findings. Which of these findings are most relevant to this scenario? So remember, we are still talking about the same elderly patient that fell, and now the nurse went to the patient and completed an assessment and identify several things. The nurse identified 10 things: temperature 96.8, heart rate 90 beats per minute and regular, respiratory rate 22, BP 162/88, SpO2 91 on room air, alert, oriented ×3 to person, place, and time. States that the pain is 10 out of 10, so severe pain. We're whimpering and holding right hip, right leg and foot externally rotated, and right leg shorter than the left leg. So what I want you to do, I want you to tell me the number in the comment section of what you think are most relevant to this scenario. In this question is a select all that apply, so you can have more than one answer. It could be 1, it could be 2, it could be 5, it could be 9 answers. Select all that apply. So let me see. I see some of you selecting 7, 9, and 10. 3, 4, 8, 9, 10. 3, 4, 7, 8, 9, 10. Only 9 and 10. Seven, 8, 9, 4, 7, 8, 9. All right. Wow. You see how difficult this question can be? But do not worry. I got you. I'm here to help you, because I will show you how this strategy can help you select the correct answers in these type of questions. If you're ready, comment, I'm ready. I'm ready to learn this new strategy. So the strategy is as follows. The first thing that you're going to do is you're going to look at each answers, at each of the assessment data, and you're going to decide or determine if the findings are normal or abnormal. So that's step number 1. Identifying if it's normal or abnormal findings. Number 2, if the findings are abnormal, determine if it is expected in this scenario. In other words, you can have something that is abnormal in the patient, but is expected according to what happened in the scenario. If the client's finding is expected, it's likely not to be a relevant answer. In other words, it's probably not the correct answer. So keep that in mind. You're trying to find out what is the relevant or most relevant information or answer in that scenario. You're going to see how different you're going to see the same clinical scenario now. You're going to see it differently. Number 3, if the client's finding is abnormal, but unexpected or not expected, then that is likely the relevant answer or the correct answer. Number 4, once you have determined that, then you will think of future nursing interventions that you could do to assist the patient with these relevant data that you have discovered in preparation for a future question in case you're doing a case study. Okay? Now let's go back to the question and let's read it again. Using the strategy that I just mentioned, you're going to see how clear this is. The nurse performs the initial assessment and documents these findings. Which of these findings are most relevant to this scenario? What did we first determine? Remember the first question? We determined that the patient fell, right? The elderly patient fall down. That was the focus of the question. So we cannot forget the main focus in our original question, our first question. Now, we're going to go one by one, and we are going to determine if it's normal, abnormal, abnormal expected, or abnormal unexpected. So let's look at the first one. Temperature, 96.8, 36 degrees Celsius. One thing that I can tell you about these type of questions is that all of the answers are important, and you can use all of the answers to make your decision. In other words, there are no incorrect statement here. Everything applies to the patient because the nurse collected these findings from the patient. So you cannot say, oh, this doesn't apply. No, it applies. It is clinical findings in the patient. But as you review all the answers, when we look at the temperature, 96.8, we say, well, is that temperature normal? Nope. That temperature is abnormal. Now, is it expected in this scenario? Well, think about it. An elderly patient was found on the floor, okay, after a fall. Can we see shifts on the temperature? Yes. A lower temperature could be expected. Remember, the focus of the question wasn't hypothermia. See, the focus of the question was a fall. So yes, a lower temperature is abnormal, but looking at the totality of the circumstances, this is an expected finding. Number two, the heart rate of 90, well, that is normal. Number three, a respiratory rate of 22. This is abnormal, but is expected. Well, why, Professor Ray? Why is the respiratory rate of 22 expected? Well, think about it. Look at all the clinical findings. The patient is in severe pain. So if the patient is in severe pain, do you think the respiratory rate could be somehow affected? Yes. So abnormal expected would be the analysis for answer 3. Answer 4, a little bit of hypertension, 162/88, the same thing. Abnormal but expected. Why? The patient fell, severe pain. So this will be an expected finding in a patient who fell down and is in severe pain. Alert oriented times 3, answer number 6. This is completely normal. Number 7, severe pain, abnormal and unexpected. But the most important thing is it relates directly to the scenario or the core of what we originally determined that was the most relevant information. You see the importance of doing this step by step? These type of questions are extremely hard. Do not treat this new selector that applies like you used to doing before the regular true or false. No, that doesn't work here. You have to think deep in these type of questions. Extremely difficult, but fair. Number 8, whimpering and holding onto the right hip abnormal, unexpected. Number 9, right leg and foot externally rotated, abnormal, unexpected. Right leg shorter than the left leg, abnormal, unexpected. Excellent. Well, how do we select the correct answer? Very simple. When they tell you what is the most relevant information in this scenario, select or apply, you will eliminate any answers that are either normal or abnormal expected. Therefore, answer number 1 is gone. Answer number 2 is gone. Answer number 3 and 4, gone. Answer number 5, gone. Answer number 6, gone. What is the answer? Answer 7, 8, 9, and 10. So what do you think about this question? Very interesting, right? Now, I want you to test yourself. So write down on a piece of paper what answers you selected. Let's say, for example, that you selected 1, 4, 7, 8, 9, 10. Well, you got 4 right answers, 2 incorrect answers. You got something. You did something right. What if you selected 1, 7, 8, 9, and 10? You got 4 right, 1 wrong. Very good. So as you can see that you can make some mistakes here, but you still have the opportunity to answer good. But if you develop this critical thinking and you learn these strategies, you will do much better. Okay? So I hope that you're liking this training very much. Well, apparently not, because we only have 279 likes and there are 619 live viewers. We have to fix this, guys. You need to help me fix this. This is not fair for me. Come on. I want to see those likes. Let's help YouTube show this video to a lot of people out there. So each one of you, listen to me. If you're here and you're listening to the video and you find this interesting, there is no reason whatsoever for you not to find that little like button and like it. That is the least thing that you can do to show appreciation. All right? So I want to see by the end of this live training at least 600 likes. All right? So let's see if you are kind enough to do that. All right. Well, if you want to see more, comment on the comment section. More, Professor. I want to see another question. So, which relevant client findings are of immediate concern to the nurse? Oh, we took this to another level. Why? Because now you're not only determining what is relevant, but now we're dealing with a prioritization possible style question where you have to identify what is the immediate concern. So what do you mean by that, Professor? Well, let's look at this scenario. I always like to put a scenario so it makes sense to you. So let's say the scenario is the nurse reviews the medical record of a 65-year-old client admitted to the emergency department. So that is the scenario. Now, in this scenario, they gave you a nurse's note. So the nurse documented a note at 1500 hours. It says, admitted to the emergency department, accompanied by husband of 40 years. Do you think that's relevant? Do you think that's important or really important? Probably not. Started having intermittent difficulty breathing and palpitation. Uh-oh. We have an ABC problem here. This better be somewhere on your relevant information. Notice that we don't have here the patient fell down, the patient has COPD, the patient has asthma. We don't know anything yet. Keep reading. It says that the patient started having intermittent difficulty breathing and palpitation 2 days ago. The patient able to walk short distances. History of type 2 diabetes mellitus, hypertension, and obesity. And the patient lost 70 pounds over the past several years. As you can see, the scenario is not very clear yet. And that happens sometimes. You need to see the question in order to make it a little bit more clear. And look at the question. This type of question is known as the select N select-apply. The previous question we saw was just a select-apply, where you did not know how many correct answers are available. In this question, well, the NCLEX wants to be very nice to you apparently, because it's telling you, hey, NCLEX Crusader, there are only 6 correct answers. So you do not have to select more than 6. Oh, this is better, right? Because at least I know that I am only going to be clicking on 6 answers. It says, which of these findings are of immediate concern? So let's look or think about the strategy that we just mentioned. Determining what is normal or abnormal, expected or unexpected. Because what is going to be of my immediate concern? Something that is non-normal and unexpected. So if your patient has fine crackles bilateral, do you think that is a normal finding? No, that would be a abnormal answer and unexpected. Why? Because just because the patient is 65 years old and has diabetes mellitus, hypertension, and obesity doesn't tell me that having fine crackles bilaterally is expected. So that is an unexpected finding. Abnormal, unexpected. So if it is abnormal, unexpected, that's my answer. Or at least one of the answers. Number 2, S3 sound present. Heart sound, S3. Well, what do you think about this? Is it normal for this patient to have S3 sounds, heart sounds? No. That is abnormal and unexpected in this clinical scenario. So that is another answer. Answer number 3. The SpO2 is 95. Well, that's normal on room air. So if it's normal, then it's not going to be an immediate concern. So answer 3 is eliminated. Tachycardia, same thing. No reason for this patient to have tachycardia. Elevated BP. Bowel sounds present times 4. That is normal, so I'm going to eliminate it. Tachypnea, this will be abnormal. History of type 2 DM, irrelevant to the scenario. So I can eliminate it. And this is what I like about the new NCLEX. So if you have eliminated this and you have 1, 2, 4, 5, and 7, you only have 5 answers. You need one more. There's only one more left. Number 9. It says difficulty breathing. ABC. Sounds just about right. Number 9 is a correct answer. Now, if we look at this deeper, what do you see in the answers? Using a little bit of critical thinking. Well, in one, that is ABC compromise. In 2, the same, circulatory. In 4, circulatory. In 5, circulatory. In 7, breathing. In 9, breathing. What's the answer? What is the immediate concern in this scenario? ABC compromise. You know this already from Maslow's hierarchy of needs, from the SAR method. And if you don't know what I'm talking about Maslow and SAR method, you need to go back to first training here at NCLEX Crusade International. All right, so you see how you can use this excellent strategy to answer both highlight style of question and also this select all that apply or select N style of question. All right? Perfect. Well, as always, I want to give the opportunity for some of you to win the free access to our NCLEX Crusade International membership. Remember, yesterday I talked about in our membership, you will have the opportunity to learn about prioritization strategies, critical thinking, EKG, dosage calculation, different categories on the NCLEX right now. And also, I will give you the opportunity to join to at least 2 live classes on Zoom per month. So who wants to be the winner? Let me see. Who wants to have free access to our membership? Let me see some of the comments in the comment section. And let's do some the spinning wheel. See, I learned that one yesterday. I'm not gonna make that mistake again. All right. Right, we have 642 live viewers and only 447 likes. You see? Not nice. Okay, so we're gonna do like I promised. 3, I will pick 3. I will give free access to 3 candidates. If we get to 634, I will do one more. I give you, you give me. So that's the plan. I'm going to give 3. If we get to 638, I'll give one more. Why don't we do that? All right. So let's see who's going to be the person to have access for free to our membership. Let's go with the first one. Let's see. The first one is our advisor. Please write these names down so we don't forget. We got Mina from Haiti. Congratulations, Mina from Haiti. You are the winner of our membership international. For 3 months, you can benefit from this wonderful academy. And we will see you in the wall of fame. So Mina, Haiti, congratulations. Let's do one more. The second one is, all right, Paul John Mutlong from the Philippines. Congratulations, Paul. I'm glad to see the Philippines here. This wheel of names is being very kind. Let's do one more. The third one. We got Roosevelt to means from the Philippines as well. Wow, very good. So there we have our 3 winners. Congratulations to you. Let me see. We got 489, almost 500. All right, so well, I said 640 something, right? But I don't like to play those games. So I will give one more person. Although we didn't get to 644, so shame on you for not helping. Let's do one more. The last one to finish our live training. We got Sherry Rose May Biascan from Singapore. Wow, congratulations, Sherry. You are the 4th winner for our membership. Congratulations to all of you. Remember, this picks automatically, so I have no control on that. So don't be too upset with me. I see. Where is Cuba? Where is Florida? I know there's many of you, and it is really a blessing to be here, guys. Thank you. Thank you for supporting our channel. All right, so let's finalize our training. Remember, tomorrow will be day 3 of our 7-day training, Next Generation NCLEX. Tomorrow we're going to talk about very, very interesting strategies, new questions. So do not miss the training tomorrow at 5 p.m. Eastern Standard Time. God bless you all. See you tomorrow at 5. Bye-bye.